Hello friends, welcome back in the channel of Clinical Care Insight. Today we are going to learn about one disease, and the name of this disease, as you are seeing, is called as the schizophrenia. Okay, it is you can say pronounced as a schizophrenia. Fine. So there is a different pronunciation, but for me it's the schizophrenia. Got it? This disease, if we talk about their literal meaning, the literal meaning is splitting of mind. It's a splitting of mind. Write it down. It is called as splitting of mind. Since it's involved the mind, it means it is a psychiatric condition. It is a psychiatric condition. So the schizophrenia is basically a psychiatric illness. It's a psychiatric illness. Now, the schizophrenia, if we talked about their epidemiology, their incidence, then you can say globally a 1% people are affected with this schizophrenia. It is as common as diabetes mellitus. Fine, it is as common as diabetes mellitus, but probably you're not seeing the patients, you're not seeing the schizophrenic patient as you are seeing the diabetic patient, because there is a very poor, you can say a poor ways to establish or diagnose a patient as a schizophrenic. As a schizophrenic. Now, this schizophrenia is starting since the adolescence time. It's starting since the puberty time, you can say specifically. It started from the puberty time, and slowly it's progress. And in advanced condition, it shows certain signs and symptoms. And that sign and symptom is categorized into the two parts. The one part is called as a positive symptom of schizophrenia, and another part is called as the negative symptom of schizophrenia. Now, in positive and this negative categorization is based on what things patients lack from their normal lifestyle and what things is added on the patient lifestyle. So the sign and symptoms which is added in the patient's personality, that sign and symptoms is called as the positive symptom of schizophrenia. And those, you can say, personality which is lacking in their normal life, they are called as the negative sign and symptoms. So the schizophrenic sign and symptoms is categorized basically into the two types. The one is called positive symptoms. Another is called as negative symptoms. Now, the positive symptom, the first symptom is hallucination. The first symptom is a hallucination. Write it down. The first symptom is hallucination. You know that generally a normal person not hallucinate. Normal person not hallucinate. They have the normal, you can say, ways of perceiving the things. Isn't it? Hallucination means a false perception. A false perception means, there's no any elephant in the boat, but if you see there's an elephant present in the boat, it is called as visual hallucination. And in the case of schizophrenia, there is a auditory hallucination. So auditory hallucination is common. Auditory hallucination. Auditory hallucination means a patient is simply sitting and now he have multiple sounds in his mind. Okay, some is saying, okay, you are this, you are that. Someone is calling, why you are sitting, why you are not running, why you are not jumping. Some sound saying, you not sit, you not stand. Okay, you just sleep. So these are called auditory hallucination. Okay, this is called as the auditory hallucination, and it is present in the schizophrenic patient. Apart from the you can say hallucination, there is a delusion. There is a delusion. Delusion means it's a first form belief. Okay, it is you can say the false form belief which is holding by a person. Okay, which is holding by a person, and that belief is not coming from their religious aspect or their socio-economical aspect. Fine, that is called as a delusion. Suppose this is a duster. Okay, and now if I am a schizophrenic patient, I am saying, no, this is not duster. Okay, this is a ball, a cricket ball. Okay, now you are coming and you are saying, no, this is a duster, but I am holding this up, my belief very strongly. I am saying, no, it's a ball. Okay, so this kind of attitude or behavior is called as the delusive behavior. Okay, a person have the delusion. Fine, no problem. Apart from this delusion, this schizophrenic patient, you can say exhibit disorganized speech. Means they are speaking those words which have no any meaning, or there are a new word called as a neologism. Neologism means a formulation, a new word which don't have any meaning. Okay, so there is a disorganized speech also present in the schizophrenic patient, and that is categorized as a positive symptoms. Positive symptoms, always remember, these symptoms are those you can say category of symptom which generally a person don't possess, a healthy person don't possess. This is added in their personality. That's why they are called as the positive symptoms. So the other symptom is that what which system? Yeah, disorganized speech. Disorganized speech. Fine, no problem. Yeah. Apart from that, patient shows a certain behavior, okay, which is abnormal. Okay, which is abnormal, and that behavior is called as the catatonic behaviors. Okay, catatonic behaviors. Catatonic behavior means patient shows certain movements, okay, which is not appropriate. So there is a problem in their movements. Okay, there is a problem in their movement. That is called as the catatonia, or also called as the disorganized behavior, or catatonia. Disorganized behavior. And disorganized behavior. And remember, this schizophrenia is very slow progressive mental illness. It's a very slow progressive mental illness, and why there is not a good way to manage this schizophrenia? Yeah, because you not diagnose the patient as early, because patients are not coming to hospital. They are silent disease. These diseases are a silent disease. Fine, no problem. Now coming to the negative symptoms. Patients have no hope. Okay, so there is a reduced motivation, reduction in motivation. Okay, patient don't have the hope. Generally, a healthy person possesses certain motivation. Okay, tonight I am sleeping. Again, in next morning I will wake up. That's also motivation. Another motivation is that if I'm involved in certain activity, okay, I will be you can say recognized by the other peoples. But this person, if you give him a 100 you can say 100 lakh or 1 crore scholarship, they won't, you can say, exhibit any positive attitude, any happiness. Fine. For them, there's no relevance of money. I don't know why, but yeah, that's there present. Okay, so there's a reduce in motivation, and there is isolation. Isolation. A schizophrenic patient don't talk with the other person. Okay, so there is a social isolation. They prefer their own, you can say, comfort zone. They prefer their own comfort zone, and that lead to the isolation. Okay, and there is a reduced expressiveness. Okay, there is a reduced expressiveness. Apart from that, these persons, they don't have the memory. Okay, so there is a memory loss as well as the reduced expressiveness. Okay, reduced expressiveness. Reduced expressiveness. Apart from that, there is a memory loss. Memory loss. This is a very dangerous psychotic condition. It's a very dangerous psychotic conditions. Patients feel this social isolation, reduction in motivation. There is the memory loss. Okay, reduced expressiveness and isolation. And most of the cases, patients take the decision for suicide. Okay, take the decision for the suicide. So suicide rate is also, you can say, high in the schizophrenia. Now, once we understood about their signs and symptoms, okay, a positive sign and symptoms and negative sign and symptoms, let's move ahead and discuss what causes this schizophrenia. Yeah, what causes the schizophrenia, a neuropsychiatric illness. Okay, what's the cause? So my friends, exact a cause for the schizophrenia is till now elusive. Okay, it's not, you can say, clear cut. It's not clear cut, but there are certain hypotheses which is nowadays, you can say, certain research proved that okay, this is just because you can say caused by the problem in certain neurotransmitter, and that theory is called as the dopamine hypothesis. And dopamine hypothesis, write it down. So if we're talking about the cause of the schizophrenia, etiology, so there is no any exact cause, but there was one earlier theory, and that theory is called as the dopaminergic hypothesis or dopamine hypothesis. Dopamine hypothesis. Now, this dopamine hypothesis is, you can say, used neurobiologically. Neurobiology is a science which deals with understanding the phenomenon of mind, understanding the, you can say, the brain chemicals, okay, and establishing the link between the this brain chemical called as the neurotransmitter with the certain psychotic diseases. Okay, so neurobiologically speaking, this schizophrenia is a problem. Okay, it is a problem which occurs in the dysfunction of dopamine hormone. Okay, dopamine hormone. Fine, no problem. But nowadays, certain research they proving that the cause of schizophrenia is exactly the, you can say, the problem in the dysfunction of the dopamine hormone. Yeah, now recently research shows it, but it's not, till now it's not, you can say, clear cut. But they are saying that it is a problem in the dopamine circulation. Okay, dopamine circulation. So what happening in this dopamine circulation? There are certain pathways where this dopamine hormones are present. Dopamine is also called as a happy hormone, okay? It is for the motivation, fine. It is for the social interaction, okay? And these dopamines are also involved to regulating the motor function in our body, okay? Motor function in our body. So this dopamine, they are generally present in the mesolimbic pathway, okay, subcortical pathway, that's called as the mesocortical pathway. Apart from that, it is also present in the nigrostriatal neurons. So mainly the substantia nigra, a brain structure which is present in the midbrain, okay, which is basically involved in controlling the motor activity of our body, okay. So in there is an increase, you can say, synthesis or secretion of dopamine, okay. So if there is an increased secretion of the dopamine, person have the hallucination, delusion, disorganized speech, okay. And in certain areas there is a destruction in the circulation of this dopamine hormone, result into the social isolation, okay, disorganized speech, disorganized species. And this dopaminergic hypothesis is also, you can say, proved by administration of certain antipsychotic drugs. Antipsychotic drugs. Now these antipsychotic drugs, they are designed to manage this dopamine secretion, okay, to manage the dopamine secretion. Dopaminergic neurons possess 5 receptors, 5 dopamine receptors called as D1, D2, D3, D4 and D5. These are the receptor, okay, a dopaminergic receptor. Now these antipsychotic drugs, they will bind over these receptor, okay. Antipsychotic drugs, they bind over these receptors and reduces the secretion of dopamine, okay. So patients won't have the hallucination, okay, or delusion. But due to the administration of these antipsychotic drugs, patient develop certain other features, okay, and that features as a group, they are called as extrapyramidal side effect. So antipsychotic drugs have the, you can say, side effect, and that side effect is called as this is called as the extrapyramidal side effects. Extrapyramidal side effect. So first, you should understand that antipsychotic drugs are categorized into the 2 parts. Antipsychotic drugs are categorized into the 2 parts. The one is called as typical antipsychotics. Typical antipsychotic drugs. And the classical example is chlorpromazine. Fine, no problem. This is a typical antipsychotic drug. Apart from that, there are certain drugs, another category of antipsychotic drugs called as the atypical antipsychotic drug. Atypical antipsychotic drugs. This atypical antipsychotic drug, one of the example is, one of the example of this drug is called as haloperidol. Haloperidol is one example. Write it down. Haloperidol, and there are certain more called qutipine, okay, and apart from that there is the chlorozine, okay. So these are the atypical antipsychotic drugs. See, the typical antipsychotic drugs, it have this, you can say that these side effects called as extrapyramidal side effect. Patient develop the motor abnormalities. Patient develop the motor abnormality. Now, which kind of motor abnormalities? Patient have, you can say, like the body, sudden body movements. Okay, sudden body movement, and one of the prevalent sudden body movement, jaw movement, is called as the tardive dyskinesia. Okay, tardive dyskinesia. Tardive dyskinesia. Now this tardive dyskinesia, it's a, you can say, a side effect of administration of these antipsychotic drugs. Which type? Basically the typical antipsychotic drugs, which is like abnormal jaw movement. Abnormal jaw movement. Patient moving their jaw abnormally. Fine, and there is no any control over that movement. This is involuntary. Fine, no problem. And the typical antipsychotic drugs, these drugs strongly bind with these dopaminergic receptors. Fine. So this shows the, that's why they are called as they are typically binding. So they are categorized as a typical antipsychotic drugs, and this shows the extrapyramidal side effect. There are many side effects of extrapyramidal side effect, and there are, you can say, the one is called tardive dyskinesia. Apart from that, there is a akathisia. Okay, and there is a loss of sensation of the muscle. What is these are the side effect of administration of antipsychotic drugs. You should remember one example called as the chlorpromazine. Okay, it's the first discovered antipsychotic drugs, a typical antipsychotic drugs. Apart from that, we have the atypical antipsychotic drugs. These atypical antipsychotic drugs, they are not strongly binding, they are transient. They are transiently binding with this D2 receptor. And they are not only binding with the D1 receptor, you can say the dopaminergic receptor, they are also binding with one receptor called as the 5-hydroxytryptamine. 5-hydroxytryptamine or serotonin. It's also bind with the serotonin receptor. Okay, and it shows the good result. It shows the good result. But there's a difference. They are expensive drugs. It is expensive drugs, so it is used less. It is used less, and this is a non-expensive drug, so it is used widely. But for using prolonged time, patient shows the, you can say, certain motor abnormalities. So nowadays, scientists claim, that this schizophrenia, it is, you can say, happen just because problem in the dopamine synthesis or dopamine secretion. It's a newly research which is proved by the certain, you can say, the certain agencies. Okay, certain agencies. Fine, no problem. Now, it will cause, but what about the risk factor? So generally the risk factors goes with, there is a involvement of multiple genes. Okay, so this is also called the polygenic disease. Polygenic disease, there is involvement of multiple genes. Scientists proved many genes which is involved in this schizophrenia. Okay, but if we're talking about the other risks, then other risks is like the season of the birth. Certain seasons are, you can say, marked with schizophrenia development. Apart from that, social isolation, urbanization, okay, and cannabis use. Cannabis sativa is a one, you can say, ingredient of a plant, cannabis plant, okay, and which is used by the person, and if you use it excessively, it causes the schizophrenia, because there is the one active compound present in this cannabis called as the THC. Okay, so this THC can also one of the risk factor for development of schizophrenia. Okay, so just motive of today's, you can say, understanding about the schizophrenia is to aware you about the current research. Okay, current research shows that the cause of schizophrenia is the dopamine dysfunction. Now it's clear-cut proof. So just go with the research paper and find out is it really true or not, and comment down. Thank you for having me. Bye. Have a nice day.